Good afternoon, everyone, and welcome to a webinar hosted by Bernie Wealth Management. My name is Kyle McFarland, and I'm an Associate Wealth Advisor on our team. I'm joined by my colleagues, Adam Newman and Bijal Patel, along with other members of our senior management. We thank you for taking the time out of your day to join us. Before we jump into the content prepared for today, I'd like to go over a couple of quick housekeeping items. First, we've allotted 1 hour for the webinar, with the first 40 to 45 minutes being the content presented by our team and the remainder of the time for Q&A. Questions can be submitted throughout the presentation, but to keep to our schedule, we will hold off addressing them until the end. You can submit your questions by selecting the Q&A icon on the top left-hand corner of your screen. Any questions that we don't get to by the end of our time today will be addressed as part of our follow-up with you, which we will outline before we close things out. Thanks for joining us today. Adam, you now have the floor.
Thanks, Kyle, and welcome, everyone. Thanks again for coming. We're going to cover a lot of ground and information over the next hour. So if nothing else, I wanted to start out by summarizing that there's really 3 key points we'd like you to take away from this presentation. Key point number 1 is going to be that if you do not enroll in Medicare on time, you will pay a monthly penalty. And believe it or not, a lot of baby boomers we've worked with over the years, they don't know if or when they're supposed to enroll in Medicare, but there's pretty clear rules that we're going to outline and walk through together today around when and how to do this. But just as a key point right off the bat, I want you to know that you will end up paying a penalty for the rest of your life if you do not enroll in Medicare on time. Key point number 2 is that if you do not get the right in private insurance to go with Medicare, you could ultimately end up paying much more in premiums and out-of-pocket costs than you need to. So the fact that you even need private insurance to complement Medicare often comes as a surprise to many people. So what we'll talk about today is what specifically will Medicare itself cover, what are the gaps, and how can private insurance complement that? So just wanted to add, really as a high-level key point, know that if you don't get the right private insurance, you can end up paying too much over time in premiums. Key point number 3 is that if you do not plan for higher healthcare costs in retirement, it's very likely you could run out of money or not be able to get the care that you need. So, hitting age 65 is a good milestone in that you get to enter into the Medicare system, and it provides a relief against higher healthcare costs. But it's important to know and quantify over the long run, what do we see in terms of trends in retiree healthcare expenses? What are the sources of those expenses and how to mitigate those? So part 1 of our agenda today, what we did is we divided this into 3 segments. So we're going to tackle part 1 now, and we're going to define Medicare, what it is, who needs to enroll, when do you enroll, and how do you enroll. Part 2, we're going to cover how much does Medicare cost, what does Medicare cover, what does it not cover, and how does the private insurance / Medicare relationship work? How can private insurance work with Medicare to give you the coverage that you need? And then finally, part 3, we'll wrap up with summarizing 2 reasons why we think your healthcare expenses will be higher in the future. We'll talk about the impact of inflation, as well as the increased need for healthcare services as you age. And we'll also hit on the point and emphasize the fact that Medicare does not cover long-term care services. So let's start with Medicare enrollment. And the first thing I wanted to summarize and show you is this quick chart of how is healthcare paid for in the U.S. and who pays for what. So before age 65, typically individuals and couples will have employer group health insurance. They might have a retiree health plan. They might be on COBRA, or they might just go out on the exchange and have their own policy. So before age 65, that's typically what we see, out there for health coverage. And now after you obtain age 65, it's important to know that Medicare will generally pay first. So the health insurance system is set up so that once a person becomes eligible for Medicare at 65, private insurance becomes secondary to Medicare. So when you incur a health expense, what happens is that bill is submitted first to Medicare, and after Medicare pays what it's going to pay, any other insurance you have may pay some or the rest of the cost. So, and there's an exception to this rule that we're going to talk about a lot today, and this is for those that are still covered under an employer group plan that has 20 or more employees. So that's that one exception. I want you to put an asterisk to that. So if you and your spouse are still covered under a group plan with 20 or more employees, there's going to be a couple of exceptions around how that integrates with Medicare. So we'll touch on that. And so that's really the big thing. So unless you are covered by this employer group plan with 20 or more employees, what happens is you have to enroll in Medicare when you turn 65. So if you don't fall under that exception, you absolutely have to enroll upon turning 65. And what happens if you don't? There are late enrollment penalties. You might have health expenses that will ultimately not be covered by insurance, even private insurance. So if you're 65 and for whatever reason still have a private policy, if you haven't enrolled in Medicare, there's no one at the front of the line to foot the front end of the bill. So private insurance claims can be rejected. And then lastly, your private insurance options, if you have to go out and purchase something, could be extremely limited. So Medicare has limitations, or the way that the system is structured, so that if you have a pre-existing condition or you're in poor health, Medicare has to accept you, which makes it very important to make sure you enroll right away. If you fail to enroll in Medicare and have to go out and just get private insurance on your own, you could have your options significantly limited. So just a quick note on who is eligible for Medicare. So as you know, it's anyone over age 65, so all U.S. citizens or legal residents who have lived in the U.S. continuously for at least 5 years. And then some people under 65 can become eligible if they're under Social Security disability benefits. So if you fall under one of those exceptions, we can talk to you one-on-one about how that works and how to enroll. But high level, let's start with just the 4 main parts of the Medicare system. So I've got this chart, and we'll move from left to right. Part A of Medicare covers part of the cost associated with hospitalizations. Part B covers part of the cost of medical services like doctor's visits, procedures, and diagnostic exams. So the bills for Part A and B, they're covered by Medicare. Part C and D are where private insurance comes into play. So Part C is an alternative way to get Medicare, and what you do under Part C is you elect to sign up for a Medicare Advantage plan offered by a private insurer, and then you get all of your services under Part A and B, and usually prescription drug coverage as well through that Medicare Advantage plan. So it's an alternative to enrolling directly in Parts A and B. So in that case, in that instance under Part C, instead of Medicare paying for your hospital and doctor's bills, it pays the insurance company offering the Medicare Advantage plan a flat payment for each enrollee, and then the plan is responsible for managing and coordinating your care. Part D, last but not least, this is the prescription drug coverage. So this is offered directly by private insurers who contract with Medicare. So each prescription drug plan that these different insurers offer, they're going to be slightly different. And this is why you want to be, and this is incredibly important, this is why you'll want to shop carefully for your drug plan. So even if you don't take any prescription drugs when you first go on to Medicare, which many times is the case, you'll still want to sign up for Part D, because what happens is if you go without drug coverage for a long period of time, penalties kick in. We'll talk about that more in a little bit and what the penalties are, but just right off the bat, really important, make sure you sign up for Part D as well. So another chart here, I think this summarizes things very well, but really the 2 ways to access Medicare, and this is a recap of the last slide. But if you go on the left, as you see, if you elect to stick with the original Medicare, what you do is you sign up for Parts A and B, and then you decide if you want prescription drug coverage under Part D. So this shows drug coverage is optional, but like I said previously, it can be dangerous to go without drug coverage given the penalties involved. So we are recommending that everyone plan to have some kind of prescription drug coverage starting from the outset of Medicare. And then what you see here is in step 3, what happens is after you've got A and B and the drug coverage in Part D, you elect at that point if you want to add a Medigap policy to fill any of the holes. And this usually becomes the case because Medicare in itself, the way it's designed, it does leave some gaps in coverage. So how do you actually go ahead and enroll in Medicare? What's the process to that, and how does it work? And we're going to break this out in 2 different ways. One is if you are receiving Social Security when you turn 65, and the other is if you aren't. So if you are receiving Social Security benefits when you turn 65, you are automatically enrolled in Parts A and B. If you're working and covered by an employer group plan, you might not want Part B. So in that case, you can decline it, but you're automatically enrolled right to start. So you'll go ahead and accept Medicare Part A and B in your coverage, and they start on the day you turn, the first day of the month in which you turn 65. So if you're already taking benefits from the Social Security system, that's done for you. Part C and D are not automatic. So if you want a Medicare Advantage plan, you'll have to contact the insurance company offering it and sign up for Part C through them. Or if you want to stay with original Medicare and have a standalone Part D drug plan, you'll need to decide which insurance company's plan you want to go with, and you'll have to proactively enroll. So this should all be coordinated so that it's happening at the same time you are enrolled in Parts A and B, preferably, and clearly our strong recommendation to have this done before your 65th birthday. So what if you are not receiving Social Security when you turn 65? And this happens, and this is more and more common today. People are delaying the start of benefits because they're continuing to work, or they want to take advantage of that increase, those delayed retirement credits you receive when you delay Social Security. So it happens. So if you're not receiving Social Security at 65, you need to proactively enroll on your own during what they call a Medicare enrollment period. And there's 3 main enrollment periods that we're going to hit on in more detail, but the initial enrollment period applies if you're not covered by a group plan at 65. The special enrollment period applies if you are covered by a group plan at the time you turn 65. And the general enrollment period is if you miss either the initial or the special enrollment period. So I know these might be new terms. Don't worry about it. We're going to walk through the timing of each of these enrollment periods and how it might apply to you. So the initial enrollment period for people who aren't covered by a group plan at 65 is going to start 3 months before your 65th birthday, and it's going to last 3 months after your 65th birthday. So it's really a 7-month period. It's 3 months before you turn 65, 3 months after, and then the month in which you turn 65. So you're given 7 months to get enrolled in Medicare. Our recommendation is start the process 3 months before so that your coverage starts right on your 65th birthday. You don't want any delays or gaps in coverage. So who signs up for Part A during the initial enrollment period? So we'll break through the different parts and who will sign up for what during which type of enrollment period. So we've talked about signing up for Medicare as a whole, but there are times when we need to break it into parts. Most people elect to sign up for everything at once, but we're going to go over some exceptions or some times when you might need to sign up for some parts and not others. So if you're still working when you turn 65, what we highly recommend you do is check with your benefits administrator and ask them if you should sign up for Part A. So we mentioned earlier that if you're covered by an employer plan, when you turn 65, you have this special enrollment period that comes later. However, you might still want to sign up for Part A, even if you're under a group plan right when you become eligible. And the reason for this, and we've seen this, is Part A might offer better coverage for hospitalization than your employer plan. So Part A is free, and so it makes absolute sense to take advantage of that if the coverage you're getting is going to be more favorable than what you would be receiving through your employer. A little bit of a side note here, if your employer group plan is what they call a high deductible plan, and you've got a health savings account associated with it, which is a great tool for deferring taxes and saving for healthcare and retirement. But however, if you want to keep contributing to that health savings account, you should essentially ignore what I just said and not sign up for Part A if this applies to you. The reason is that once you enroll in Medicare, HSA contributions have to stop. So just to summarize, if you have an HSA and your employer plan covers fewer than 20 employees, you will have to drop that health savings account and sign up for Medicare during your initial enrollment period at 65. So again, that goes, I think that's a special circumstance. If that applies to you, we can talk about it, in more detail and the mechanics around it, but just wanted you to know if you're contributing to an HSA, still employed, turning 65, there's other things you need to be thinking about. There might be a special exception we need to look at. So that's Part A. How about Part B? So who signs up for Part B during the initial enrollment period? If you're not covered by an employer plan when you turn 65, you will want to sign up for Part B during your initial enrollment period. So preferably that 3-month window before you turn 65. So if you're not working, you're self-employed, or you're covered by a company with fewer than 20 employees, you've got COBRA, you've got retiree health benefits, really anything that is not just an employer group plan, what you're going to want to do is sign up for Parts A and B during your initial enrollment period. So Part D, if you've already gone ahead and signed up for Parts A and B, and you think you'll ever in your life want prescription drug coverage, then you should absolutely enroll in Part D at the same time. So if you go more than 63 days without what they call creditable prescription drug coverage, you end up paying that late enrollment penalty when you do finally sign up for Part D. So it's absolutely better to just go ahead and get your drug coverage right away, avoid the penalties. Again, even if you're not taking medications at that time, sign up and alleviate the hassle or the potential of having to pay any fines or penalties. And also, as I mentioned before, you've got 2 options when it comes to that Part D coverage. You can enroll in a standalone private prescription drug plan, or you can get your drug coverage through that Part C, a comprehensive Medicare Advantage plan. Now that special enrollment period, so we just talked about the initial enrollment period. The second is the special enrollment period, which really only applies for those those individuals where them or their spouse are covered by an employer group plan with more than 20 or more employees. So in that case, what they allow you to do is defer. So when you turn 65, you don't necessarily you don't have to enroll in Medicare, and you're not penalized for not enrolling, but you will be penalized if you don't sign up for your special enrollment period. So the best time to sign up is going to be right before your current coverage ends. So if you're working in a large group plan and you're covered, now you don't have to enroll, but right before you officially retire or your spouse retires from her coverage, you'd want to enroll ahead of time to avoid any penalties. That's the special enrollment period. And the general enrollment period, I would hope that this is not going to happen to anyone attending this presentation today. This is essentially the enrollment period for those that have completely forgotten or missed the initial enrollment period or the special enrollment period. So essentially during the first quarter of every year, from January 1 to March 31, you can jump in at the general enrollment period and say, oops, I made a mistake. I was supposed to enroll in Medicare, but I didn't. And this can cause huge lags in coverage because when you sign up during this general enrollment period, that coverage won't begin until July 1. So you could go long periods of time without Medicare coverage. Not a good idea. So we're going to operate under the assumption that this won't apply to anyone today. So how do you sign up? You know, the mechanics of it is, I think, especially when it comes to signing up and enrolling for parts A and B, it's very easy. As I mentioned before, if you're already receiving Social Security when you turn 65, you're going to be automatically enrolled. But if not, what you do is you go to ssa.gov, and I even copied the button from the website that you click. You select Medicare. There's a tab that says Medicare, and then there's this button that says Apply for Medicare Benefits. There's also this phone number. If you prefer to work with the Social Security Administration directly, there is the number that you can call to get enrolled. So that's part A and B, very straightforward. You're either automatically enrolled at 65 if you're taking Social Security, or if not, you proactively enroll by going to the website or calling the number. Part D is not quite as straightforward because the first thing you have to do is you have to decide how you want your prescription drug coverage. So we mentioned earlier, you have two options. You can either A, buy a standalone prescription drug plan to complement Medicare's Part A and B. That's option one. Option two is you can get a more comprehensive Medicare Advantage plan that's really A, B, and D hybrid. So depending which of the options you go with, that'll determine how to sign up, the costs involved, and things of that nature. So that'll be very specific to you. So we're going to hop over to part two. So this is a good segue, I think, to the coordination of Medicare with private insurance. So I've got a pie chart here that shows the breakdown of spending by the average Medicare beneficiary for premiums and services. So it really gets a good chart that's going to quantify the average out-of-pocket spending on different types of services by Medicare beneficiaries. And this is dated 2013. This is the last time this survey was completed, so the numbers might appear to be a little dated, but this is actually the most recent survey. So we're going to break this out. We're going to look at premiums versus services and the costs and what you can expect. So focusing on out-of-pocket costs paid by the beneficiaries of Medicare, they're going to fall into two main categories. So as I said, it's the premiums that you pay, so insurance premiums, and then the out-of-pocket costs and expenses that aren't covered by insurance. So monthly premiums are paid to Medicare and to the private insurance companies offering the drug plans and any Medigap policies or Medicare Advantage plans. So you pay the premiums, the cost associated with that we'll talk about in a minute. But the out-of-pocket costs are going to be deductibles, the portion of any bills not paid by Medicare, and any services not paid by Medicare. So monthly premiums, I think, when it comes to Medicare, it's pretty straightforward. So Part A, as I said earlier, is free if you or your spouse has paid into Medicare over 10 years. So no cost to Part A if you meet that 10-year requirement. And this is exactly the reason why most people sign up for Part A when they turn 65, even if they're still covered by an employer plan. There's really no downside. The coverage might be more comprehensive than what you already have, and it becomes a good complement to what you're doing. It doesn't cost anything. Part B is different. So the premium for Part B is $134 per month per individual for 2018. That Part B premium is adjusted for inflation, so it could be higher over time. And then lastly, the Part D premiums are going to be paid to a private insurer. It's going to vary with the plan. One last thing about Part B that we're going to talk about now is this idea of an income-related adjustment. And this really is incredibly important, and we've seen clients fall prey to not paying attention to this, and they get hit with certain penalties or a tax, however you want to classify it as. But this table, it's going to show the Part B and Part D premiums for different income levels. So if you're single and your income is under $85,000 a year, or if you're married and your income is under $170,000 a year, you'll pay the regular Part B premium and there'll be no income adjustment to your Part D premium. So as long as you fall under those income thresholds, the premiums that you pay will be standard across the board. But for those couples and individuals that go over those income amounts, you can see on the right what these adjustments are, and it could end up being an extra couple $100 a month between you and your spouse if you aren't managing the income that you're generating in retirement. So you might have no control over this. Maybe you've got a business that is kicking off income. But I think to the extent in which you can manage this, absolutely do so, because as you can see, these different adjustments, these added amounts to the monthly premiums can add up to several $1,000s a year. So these are the numbers. This is the chart. We can provide this to you if you'd like a copy. But last thing I'll say is that these numbers up here, they don't include the premiums for any Medicare Advantage or supplemental plan. So this is just a straight Part B and D, average premiums, and then the income adjusted amounts. So deductibles. So on top of those premium amounts, there's going to be some other out-of-pocket costs in the form of deductibles. So if you have to be hospitalized, the first $1,340 in hospital costs are going to come out of your own pocket before Medicare starts paying. Some private plans will cover this, as we'll see in a minute. So just so you know, first $1,340 per hospital visit, you foot the bill. Part B deductible is straightforward. It's $183 a year, and that can even be waived for certain preventative services like flu shots and screenings. Part D, the deductible is about $405 per year under the standard Medicare design, but this coverage is complicated and personal to you. So we'll see that in a minute. So you've got the premiums, you've got those deductibles, and once you've gotten over the deductible, this co-insurance kicks in. And it is what the name implies. You're co-insuring. Yourself and the insurance company are sharing in some of the costs. So if you're just as an example, if your hospital stay exceeds 60 days, so you might have met the deductible and you've been in the hospital for 60 days, of which Medicare covers most of that. But if you get over that 60-day mark, you're going to be responsible for $335 a day up to the 90th day, and then $670 per day up to the 150th day. And then after that, once you get over day 150, you're going to pay the full cost. So that's the hospital component of it. The other is skilled nursing. So Medicare will pay the first 20 days of skilled nursing care. After that, you'll pay $167.50 for days 21 through 100. And if you need more than 100 days of skilled nursing care, that's when you've got to foot the bill and pay the full cost. So just important to know, these are different numbers, different brackets. They can change over time. Conceptually, what I want to get out and really hit on is that there's a cost-sharing component. There's date ranges applied to it, and then you can be on the hook for significant dollar amounts if you don't plan carefully or budget carefully. The Part D coinsurance here is complicated. So just whenever you hear Part D, just think it's unique and it's complicated. That's the theme that we're following. But we could essentially spend all of our time talking about Part D if we wanted to, but we're just not going to do that. But the main thing to understand is that there are cost-sharing arrangements under Part D, no matter which prescription drug plan you choose. So there's 4 levels that I've outlined here. Level 1 is the annual deductible of $405. Second level is the initial coverage period. And that's when the drug plan will pay 75% and you pay 25% of covered drugs. Okay. And after these total costs have exceeded $3,750, you fall into what they call the donut hole. And that's when you end up paying 35% of covered brand drug names and 44% of generic drugs and 100% of the rest. So between that dollar amount, that's $3,345 and $5,000, you essentially are on the hook until you get over that $5,000 hurdle. So This is under the basic Medicare model. So some of the drug plans, the private plans, are going to offer more coverage, and they're going to offer different coverage for different drugs. So this goes back to the idea that you need to shop very carefully for drug plans based on the medications that you personally take. So what does Medicare cover? So after looking at all of these out-of-pocket costs that you might have to pay, you might be wondering what it does cover. And here's just a couple of bullet points. So it does cover the first 100% of the first 60 days. It covers 80% of the cost of approved Medicare amount of doctor's visits and outpatient services, and then some preventative services. And I want to point you to a resource which is on the Medicare.gov website. It's called Medicare and You. I'd say an absolute requirement for all of you to take a look at it. I think it's informational. It outlines very clearly and specifically what's covered and what's not. It talks about enrollment, so I think it'll be a good summary for what we're talking about today. So it's called Medicare and You, and again, it's at Medicare.gov, the government website for the Medicare system. And here's what it doesn't cover. Here's a list, and in that Medicare and You document, it actually spends a bit of time, discussing what's not covered under Medicare. So here's a short list of, I think, some of the big items. And so this is really where private insurance comes into play. So you know what Medicare covers, you know the high level what it doesn't, but private insurance can come a very good supplement or a complement to Medicare. So it can cover all or part of your deductibles, the hospital costs after 60 days, and that 20% of doctor bills that Medicare doesn't pay. And of course, all prescription drug coverage to go along with it. So Medicare, as we said, that alone doesn't cover them, but depending on the drug plan and depending on what your needs are, private insurance can become, and I think absolutely should become, a complement to your comprehensive, retirement health care plan. And that's really, where Medigap policies can come into play. So it's called Medicare Supplemental Insurance. These are issued by private insurance companies, and they're specifically designed to fill the gaps that Medicare doesn't cover. So although they're not affiliated with Medicare, they actually have certain federal and state laws designed to protect you. So Medigap, as you hear that term thrown around a lot, it's used to fill the holes in the Medicare system, and is something that should be considered. And under Medigap, these policies are standardized, and they're identified by letters A through N. So just as an example, if you buy a Plan F in California, it offers the same benefits as a Plan F in New York. So same thing, standard across the board. However, and this is incredibly important, the premiums can vary considerably from company to company and even from area to area. So there was a county in Florida where the monthly premiums for Plan F, the same plan, ranged from $192 to $460 a month for the exact same policy. So this is why it's so important to evaluate Medigap insurance and not pay too much money for it. So this is a chart. Again, we can, if you reach out, we can make this available to you, but it talks about what's covered under the different, those A through N policy listings. You can determine on your own, really what you think your needs will be and what's important to you. But this is all part of that comprehensive retirement healthcare plan that you should be thinking about and the costs involved with it. So this is just a reminder, I'm going to say this really one last time, that you really need to shop carefully for private insurance. So we know Medigap policies are standardized, but like we just saw with the example in Florida, the premiums are going to vary considerably. So first, choose a plan. The way to think about this, and I think the best way to approach it is first choose that plan that offers the coverage you need. So I just showed that chart with the listing of A through N. You could see which of these is really best for me, and then go out and be very diligent in looking at different companies, the policies they offer, and then pick the one with the lowest price. So we know all the F plans, all the N plans are standard. All you have to do at that point is go out and compete on pricing. So, and the other component of this, that's Medigap, but the drug plans are going to also vary considerably. So we talked about Part D and our recommendation to just enroll in it, even if you're not on medications now, and why that's so important. Enroll and then take the cheapest plan available. You don't get penalized for upgrading or changing your policy in the future, but you will get penalized for not enrolling. So even if you don't take prescription drugs at 65, absolutely consider that. And then if you do take medications, if you're on prescription drugs, it's very I think it's incredibly important to examine each plan's drug list to see what kind of coverage is provided for the medicines that you take personally. There's, usually upon request, you can get this list. You can evaluate it and look at the cost sharing component. But, this is really something to be mindful of and to consider. So we covered a lot of ground on Medicare and enrollment, the timing, the penalties, the income component. So that's a lot. We crammed a lot about Medicare in a short window of time. We'll give you an email address if you have any follow-up questions for myself. We'll address them on a one-off basis to make sure you're getting all of your bases covered. But now I'm going to pass it to Bijal, who's going to round this out comprehensively and really talk about the idea of planning for higher health costs in retirement.
Thanks, Adam. You shared a lot of good information on Medicare. Every time I hear it, I pick up something new. In terms of thinking about higher costs in healthcare and retirement, here's a look at healthcare spending by gender and by age group. So what you'll see is that women tend to spend more on healthcare than men. What's no surprise is that older people spend more than younger people. But in terms of further examination, a large part of these costs are, as you get older, the expense associated with long-term care. Here's what a typical Medicare budget might look like today. Considering premiums only, if you're not subject to any surcharges, Part B will cost you $134 a month. Medigap Plan F premiums should be about $200 a month. And for Part D, the drug premium at $40 a month, for a total of $374 per month. Considering both premiums and out-of-pocket costs, the typical healthy Medicare beneficiary may spend nearly $6,000 a year in premiums, not covering prescription drugs and other out-of-pocket costs such as dental, vision, and alternative care. What can cause your healthcare budget to change? Two things: inflation and the possibility of getting sick. As healthcare costs continue to rise, insurance premiums go up and non-covered services that you pay yourself get more expensive. If you get sick, you may need more expensive prescription drugs and have to spend more than you planned for, putting yourself in that donut hole that Adam talked about earlier, having to pay many more thousands of dollars a year for medications. There's always the possibility that as you age, you'll require more non-covered services like major dental, hearing aids, and long-term care. How can you plan for rising healthcare costs when you're on a fixed income in retirement? One way is to set aside enough funds so that you're self-insuring for retirement costs. Fidelity does a study every year to determine the average amount couples might spend in retirement at the beginning of retirement. So if you're setting aside funds to pay for long-term care, Fidelity says that the average person retiring today will need $275,000. The Employee Benefit Institute did a similar study with slightly different variables and came up with males will need approximately $124,000, women would need $140,000, and combined couples approximately $259,000 at the start of retirement to pay for insurance costs in retirement. Again, these are just averages, and your particular situation may be different. It's important to take a look at, will you live longer? Are you healthy? And what will change down the road? How many of you know someone who's gotten old and needed long-term care? We're not necessarily talking about nursing home care. Long-term care can range from someone coming to your home for a few hours a week to help with meal preparation, skilled nursing care. The important thing to know is that Medicare and Medigap do not cover long-term care. The most comprehensive Medigap policy pays for only 100 days of skilled nursing. But if you're not sick enough for skilled nursing, they're not going to pay for it. The average period of skilled nursing care is just 28 days. When it comes to custodian care for help with activities of daily living, there's no coverage at all. As you look at this chart, you may say, I'm not getting old. I'm not going to need this help. Consider this. 42% of Medicare enrollees have activity limitations. Some of them need help with so-called instrumental activities of daily living, which include things like shopping and cooking. Others need help with things like bathing and dressing. Here we look at what causes activity limitations. At every age level, the most common cause is arthritis, followed by heart problems. And as it only becomes worse with age. Senility and dementia are relatively a low occurrence for someone who's in early retirement between the ages of 65 and 74, but it becomes more prevalent as someone who's in late retirement, either in their 80s or 90s. When you're healthy and active in your 60s and early retirement, it's hard to imagine not being able to bathe or dress yourself. But it's just a fact of life, and people need help as they get older. Nearly half of people over the age of 85 have some difficulty walking, and this in itself can limit things you could do by yourself. For most people, the need for long-term care is very gradual. You start off needing help with just shopping, meal preparation, and doing some housework, maybe managing your budget and traveling. This level of care is often provided by a family member or paid housekeeper. Level 2 is when things start to get difficult with essential activities of daily living, such as eating, bathing, dressing, going to the bathroom, transferring from a bed to a chair, and maintaining cognizance. I know nobody likes to think about these things, but we all know people who've had to need custodial care. The third level of care is skilled nursing care. This is care provided by a licensed nurse for medical condition or rehabilitation. Sometimes this level of care is short-term, and if you need it for less than 100 days, Medicare and Medigap might pay for it, depending on which Medigap policy you have. But sometimes skilled nursing care is needed for a longer period of time, and the cost can become burdensome. How much does long-term care cost? Well, it varies with the type of care, of course. Genworth does an annual survey that shows the average cost across the United States. Homemaker services cost about $131 per day, and home health care aid services cost about $135 per day. Adult daycare costs about $70 a day on average. However, the range varies from as little as $15 a day to as much as $160 a day. Things start to get more expensive as you need assistance in a living facility, which can range from $674 all the way up to $9,400 per month, depending on location and which amenities are important to you. The median monthly rate is about $3,750. The most expensive type of care, of course, is nursing home, where residents can get skilled nursing care. A private room ranges from $89 a day all the way up to $826 per day. The median daily rate is $267. 1 year at this rate, and you're almost spending $100,000 a year for care. None of us want to think about getting old and needing long-term care, but there are some very compelling reasons why we need to. One is to spare kids or other family members the burden of taking care of you. They may not mind shopping or paying your bills, but if you're in need of constant supervision with help with bathing, dressing, that goes well beyond the call of duty for any devoted family member. Another reason to plan for long-term care is to avoid spending down your assets in order to qualify for Medicaid. This is a state-run welfare program that will pay for care if you don't have any money. But that's the point. You have to spend down your assets to less than $2,000 in order to qualify, essentially leaving yourself broke. People on Medicaid don't have a lot of choices about the care that they are going to receive. And this is another reason to plan for your own long-term care, to be able to direct your own care and obtain the kind of quality of care that you want. When you're paying for it out of funds that you've set aside or have insurance, you can decide how you will be cared for, whether it's in your own home or in an assisted living facility of your choosing. We've helped many clients to monitor and implement plans in terms of how they're going to pay for future long-term care costs. We're more than happy to help you understand, should you self-insure? Should you be looking at a private insurance policy? I can say a lot more about long-term care, but a lot of it becomes customized directly to you. So please reach out to us and we'd be more than happy to talk to you. I would leave you with 3 reminders, though. There's a lot more that I could say. One is to enroll in Medicaid on time, that I mentioned. That magic number, 65. If you wait, however, please pay attention to what your employer plans are. Reminder number 2, shop carefully for private insurance to go with Medicare. Evaluate all of your options. Choose a drug plan, a Medigap policy, a Medicaid Advantage policy that has the coverage that you need at the price that you can afford. Don't be one of those that just goes with the flow and ends up paying much more than you needed to. Allow us to help you find out what is the appropriate coverage for you. And finally, planning for higher healthcare costs in retirement. We know healthcare expenses will be higher than they are today. So when planning for retirement, figure out how much savings you'll need to make your money last. Be sure to factor in an extra amount for healthcare. You'll be glad that you did. This concludes today's planned presentation. I am going to turn it over to Kyle, who will help close out the conversation. Thank you.
Thanks, Bijal. Before we get to questions, I want to make some quick closing comments. On behalf of Bernie Wealth Management, we want to thank you for your time this afternoon. We hope it was as valuable and educational as we anticipated. We covered a lot of ground today, and you probably have many unanswered questions about how this information might apply to your personal situation. Our team is available to speak with you on an individual basis to identify planning opportunities that you can take advantage of. My email is now shown on the screen in case you'd like to touch base with me directly to schedule a time to speak with our team in more detail. Now let's tackle some of your questions.
Okay, we're running up on time here a bit, so we got a lot of questions, a lot of very good ones. So just to start, we are going to be taking inventory of these. So for whatever reason we don't get to your question during this time, we'll follow up personally, make sure all of your questions are addressed and that you've gotten everything you can out of this presentation. But it looks like there's a few common themes here, so I'll try and hit on those to start. The first one is around, we talked about the exceptions for enrolling to Medicare, or the process if you are or are not taking Social Security at age 65. And there's a couple of questions specific to that. Should I or shouldn't I be taking Social Security at 65? And we'll, we talked about this in another presentation 2 months ago, but that decision around when you should or shouldn't, delay your Social Security benefit becomes incredibly personal to you. We know for a fact that taking it early before your full retirement age, which for many people on this call will be between 66 and 67, taking before that date, you're penalized a bit. So you have to have a very good reason to do it. So I would say talking high level, I would say in 8 out of 10 cases, it would be our recommendation, or what we would find is that you are not taking Social Security at the time you turn age 65. So you'll want to focus on that part of the enrollment process, that is you proactively, taking charge and enrolling for parts A and B as they apply to you. So, good question, but that decision and that analysis is going to become very specific. The other here is, and there's a couple of around taxes, and we talked about those income-related adjustments in the the $170,000 amount for married filing jointly, and the $85,000 amount if you're single. The idea that as long as your income at 65 and after is falling below those thresholds, you don't pay those additional monthly, I'm going to call them penalties, you can call them a tax, but they're add-ons to the premiums to Part B and D, which can add up to several $100s a month. So it's this whole idea of managing your tax bracket and managing your tax thresholds. I would say most retirees, when they're turning 65, they aren't earning income over and above $170,000 a year. So if that's the case, how do you make sure you stay below that threshold? I'd say number one, manage the taxes in your portfolio. So be mindful of capital gains. Be mindful of money coming out of any retirement accounts. Be mindful of Roth conversions that you're conducting. So we know there's a long list of activities that can cause a tax event. I would say just be very conscious of what you're doing, and know that those thresholds, there's a trade-off. So if you generate income over and above those amounts, you have to have a good reason to do it, because those penalties can compound over time. So that's another one. Couple questions around shopping for private insurance. Where do I go? Who do I contact? I would say we've got we are not in the business of selling insurance, but we've got people in our professional network that are, not affiliated with Bernie Company, but that we have clients to work with that, can help educate you and help you shop around based on your state to price out policies and answer any questions. So that's something. I've got a few of these here around, where do I go? What do I do on the private insurance side? And just so we can at least make an introduction and help you on that front. And so some of these other questions, though, they look to be pretty specific and personal. So I will make a really strong, emphasis on follow-up and make sure we contact you directly. One last, it looks like someone here wanted me to go back in to another chart, which I'll do, around the two different ways to get into Medicare, either directly or through private. So I'm going to pull that up and walk through that one more time, because I don't think we spent too much time on that slide. So I'm going to hop back real quick. Here it is. So I think we talked in detail about this option one. So original Medicare versus option two, which is going private with the Medicare Advantage plan. So just to summarize, and I got a couple of specific requests to go over this again. Option one, what you're doing is you're enrolling directly through Medicare in Part A and B. And we talked about how to do that. Either it happens automatically if you're taking Social Security, or you've delayed, so you contact you go to Medicare.gov and you enroll that way. And then from there, once you've got A and B together, then you go to private insurance for Part D, prescription drug, and then a Medigap policy. So that is the standard, let's say, Medicare, option. I'd say a lot of people go down that path. It may or may not be right for you, but that's the traditional path to get Medicare. Option 2 is going straight through on the private end to a Medicare Advantage plan. So they act just like HMOs or PPOs, but they essentially give you parts A, B, and D all in one policy. So again, this option 2 is just go right to the private market, get A, B, and D wrapped into one simple policy, and then that's where a lot of due diligence, cost shopping is done on your end. So you see page numbers referenced on this slide, like pages 61 to 64 on the top left. That's because this exact chart was pulled right from that Medicare and EU document on the Medicare website that I talked about. So definitely make sure you take a look at that. So I think this is going to close out questions. We're coming right up here on 1:30 Eastern time. So I'm going to just to close things out as everyone's signing off, go back to Kyle's email. So any questions, we want to make sure you get all the value you can out of this presentation. Follow up with us, and we'll catch you next month for our February webinar, which will be 20 questions to consider when selecting your optimal retirement date. So I think another good retirement topic, and we'll send out a notification around that. But please let us know any questions, any feedback. We're here to help. Thanks a lot. Enjoy the rest of your week.